Okay, then now coming to topical fluorides, we finished with the systemic fluorides. Now coming to topical fluorides. In topical fluorides, the first one will go, each will go one by one. Now as I told in the classification, there are two types, professional and self-applied. In the first one will be professional. That means you need a doctor only to, you need a doctor to put this in the patient's mouth. Now in that, the first one is sodium fluoride. Very, very important, sodium fluoride. Okay, now sodium fluoride, it was introduced by Bibby in the year 1942 and Knudsen. They both separately they had worked, but both of them more or less came with the same thing. Okay, so it was introduced by Bibby and Knudsen. The percentage used is 2% sodium fluoride is used. Okay, the pH is 7. It's a neutral sodium fluoride. Please remember, it's neutral sodium fluoride. Okay, ppm used is 9,200. The ppm of sodium fluoride is 9,200. And next thing in sodium fluoride is method of preparation. How is sodium fluoride prepared? Okay, it is 2% sodium fluoride. Okay, it is 2% sodium fluoride. 20 grams of sodium fluoride is dissolved in 1 liter of water. Okay, the method of preparation is 20 grams of sodium fluoride is dissolved in 1 liter of water. Okay, next in sodium fluoride is technique of application. Technique of application. The technique of application used is called as Knudsen's technique. The technique of application used is called as Knudsen's technique. Okay. Now there are Knudsen advocated that it should be applied at 3, 7, 11 and 13 years. So in the exam, if somebody asks you what is the minimum age for which you should start topical fluorides, it's a vague question. So the minimum age for professional topical fluoride is 3 years. Okay, remember. Now these age groups were chosen by Knudsen because they correspond to the important eruption sequence of the important eruption dates of the teeth. Okay, now 3 years is targeted because he wants to target deciduous teeth. Okay, because they have 3 years, permanent deciduous second molar also has erupted. At the end of 7 years, the aim is to target permanent first molar. At 11 years, the aim is to target premolars, and at 13 years, the aim is to target permanent second molar. Okay, so these age groups were chosen by Knudsen to correspond to the important eruption dates of the teeth. Okay, now in each age group, okay, so when the child attains 3 years, the patient should visit dentist, okay, at 4 weekly intervals. The patient at each age group should visit the dentist at 4 weekly intervals. So let us say first week, second week, third week, fourth week, all back to back. So at weekly intervals, the child has to visit the the dentist at 4 weekly intervals. Okay, at first week of each age group, okay, the child should undergo at first week of each age group. So there are 4 weeks, isn't it? The first week the child should undergo oral prophylaxis. The second, third and fourth visit he need not undergo. So there are going to be basically the child is going to visit 16 times. 16 visits are going to be there of the child. Okay. Now, once the oral prophylaxis is done, then isolation has to be done. Isolation is done, okay, either with cotton rolls, preferably, because teeth would have just have cotton rolls, or rubber dam, isolation is done. After isolation, each tooth should be applied with sodium fluoride for 15 to 20 seconds and allowed to dry for each tooth should be applied with sodium fluoride for 15 to 20 seconds and allowed to dry for 4 minutes. Now comes the twist here. If applied beyond 30 seconds per tooth, okay, it leads to a phenomenon called as choking off. It leads to a phenomenon called as choking off. Now, if you remember, in the other part of the lecture I had told that whenever you apply any topical fluoride, now here sodium fluoride is applied to the tooth surface, hydroxyapatite contains what? Calcium. Hydroxyapatite contains calcium, phosphate and hydroxyl ions, isn't it? So eventually the aim is it will form fluorhydroxyapatite and calcium fluoride. Okay, calcium fluoride. This calcium fluoride that you are seeing, you want that to act as a reservoir of fluoride in the oral cavity, so that even after some days this fluoride keeps coming out and helps in fighting the caries. But if you apply sodium fluoride for more than 30 seconds per tooth, then this calcium fluoride will act as a barrier. Instead of acting as a reservoir, it starts acting as a barrier. This barrier will prevent further penetration of fluoride into the tooth and leading to a phenomenon called as choking off. So please remember, sodium fluoride should not be applied for more than 15-20 seconds and should be allowed to dry for 4 minutes, because you want calcium fluoride to act as a reservoir and not as a barrier. Okay. Next comes caries reduction. The caries reduction with sodium fluoride is in the range of 30%. Caries reduction is in the range of 30%. It has its own limitations also. Actually the only limitation with sodium fluoride is only one. A patient needs to visit dentist more frequently in a short span of time. Okay, so this is the only, that means because the child has to visit 4 consecutive weeks, isn't it? So the child has to visit, so there's the only limitation. He has to visit more frequently in a short span of time. Okay, now this is about sodium fluoride. Similarly, you have stannous fluoride. Okay, stannous fluoride was introduced by Mueller. Okay, there are 2 concentrations, 8% and 10%. The concentrations are 2, 8% and 10%. 8% is for children and it contains 2% of fluoride. Okay, even though it is called 8%, it is equivalent to only 2% of fluoride, whereas 10% is used for adult and it contains 2.5% of equivalent fluoride. Equivalent fluoride. Okay, the pH is acidic. Okay, it is somewhere around 4. Okay, ppm is very high, 19,300. Next comes method of preparation. Please remember, stannous fluoride is highly reactive to the environment. It is highly reactive to the environment. So when it gets exposed, it forms a white cloudy layer. That is containing tin hydroxide. So the white cloudy layer is nothing but tin hydroxide. So it is highly reactive. This white cloudy layer that is formed, it will inactivate stannous. So stannous, see, the advantage with stannous fluoride is that it is not only fluoride is anti-carcinogenic, but even the stannous is anti-carcinogenic. But if you expose it to the environment, it forms a white cloudy layer containing tin hydroxide. So the stannous is not available for preventing caries. That's why stannous fluoride has to be freshly prepared. Before application. Okay, how do you prepare that? It is prepared by adding 0.8 grams of stannous fluoride capsule. Now you get pre-measured capsule of containing 0.8 grams or 1 grams in 10 ml of water. Okay, because this is another important question for you. It forms a white cloudy layer containing tin hydroxide, hence it is freshly prepared. You prepare by adding 0.8 grams of stannous fluoride capsule in 10 ml of water. Next comes the mechanism of action. Okay, it is applied annually or semi-annually. It is applied annually or semi-annually. Applied annually means that means you apply either 6 months or once in 6 months or once in a year. Okay, applied for 4 minutes after isolation and oral prophylaxis with the brush applicator. Okay, with a brush applicator. Now, when you apply stannous fluoride, 4 end products are formed. 4 end products are formed. When you apply stannous fluoride. Okay. The first is tin hydroxyphosphate. This is responsible for the metallic taste. So when you apply stannous fluoride, it is going to give you a metallic taste, and the product which is responsible is tin hydroxyphosphate. The second is tin trifluorophosphate, and the third is calcium trifluorostannate. Okay, these two are responsible for the anti-caries effect of stannous fluoride. Okay, and the last one is calcium fluoride. As I've told you, with any topic of fluoride, eventually the end product is going to be calcium fluoride. Now, advantages of stannous fluoride: K's reduction is in the range of 32%. It is the agent of choice for rampant caries. Agent of choice for rampant caries because it stains the incipient lesions or demineralized lesions. Okay, so because it stains, it is the agent of choice for rampant caries. It comes with its own limitations, though. Lots of limitations are there as far as stannous fluoride is concerned. The first limitation is needs to be freshly prepared. Okay. The second limitation is causes a metallic taste in the oral cavity. Okay. The third is it causes pigmentation of incipient lesions. Okay. The fourth is it causes burning or blanching of soft tissues, gingiva. Okay. In spite of all these things, stannous fluoride is now used but very less frequently.